Good afternoon to everybody in Rhode Island, and thank you again for tuning in to today's update. Today's at 2:30, but starting tomorrow, we will be back to our regular time, 1 o'clock every day, 7 days a week. This is the best place to have, to get your information, most up-to-date, accurate information on the coronavirus here in the state of Rhode Island. Today, I am very sad to report another 5 deaths in the state of Rhode Island as a result of coronavirus, bringing us to a total of 35 losses. We have 220 new cases for a total of 1,450 cases, and we now have 143 people in the hospital. The number of people in the hospital is what we are very focused on now, and tracking how quickly that number doubles and increases. And 143 people in the hospital, we're at a good clip of increase, which means, again, we are in the rapid spread phase of the virus, and you should assume at this point that there is widespread community transmission. A few quick notes today. I'm trying to respond today on the basis of the questions we're getting most frequently at this point in time. So the first note I have is around testing. A couple of days ago, I announced that in Rhode Island, in partnership with CVS, opened a rapid testing facility in the parking lot of Twin River in Lincoln. This is going very well. And it's a test where you drive through, you're swabbed, you're tested, and you have your results within a half an hour, hopefully less than a half an hour. However, we hear that a lot of people are going into CVS pharmacies requesting a test. You cannot do that. The only way to sign up for a test is to go online to cvs.com. So if you have symptoms of coronavirus and you want to get tested, go to cvs.com and make yourself an appointment. And at the time of your appointment, you have to drive to Twin River, and they have a facility there which we have set up. They're working in collaboration with us, and you'll be tested and you'll get your results right there while you wait in your car in the parking lot. But please do not go into your local CVS pharmacy because you will not be able to get tested. These tests, as I say, are rapid. So we want those tests to be reserved for people who are 60 and older, healthcare professionals, people who have to go to work, essential workers, people who need to get a rapid result. And it's only for adults. It's 18 and above. If you are under 18, or if you are young and healthy, but you have symptoms of coronavirus, we need you to call your doctor or call your kid's pediatrician. And if you call your doctor or call the pediatrician, they can then make you an appointment for a test, but they're not going to send you to CVS. They will send you to one of the other numerous sites around the state being operated by the National Guard, where you will be swabbed and you will get the results of your test in 1 to 3 days. Very important. These tests are accurate, most accurate, on people who have symptoms. So we are not encouraging testing of people who don't have symptoms. So if you have symptoms of coronavirus, you can go to cvs.com and make an appointment for that day, or call your doctor, and they will get you an appointment for one of the other testing sites. At this point, we have capacity to do well over 2,000 tests a day. So if you tried in the past to get a test and you couldn't, try again. Our systems are better, and they'll be even better tomorrow than they were today. Final point. For cvs.com, you can only make an appointment for today. That will be changing soon. By this time next week, you'll be able to go on cvs.com on a Monday, and if they're booked up on a Monday, you can make your appointment for a Tuesday or a Wednesday. That functionality isn't up yet. So for today, go on in the morning, cvs.com, make your appointment for that same day. So I hope that clarifies. And again, please do not walk into the CVS pharmacy. It's dangerous. If you have the virus, you'll be spreading the virus. We don't want anyone who's sick to be leaving their house, period, unless you already have an appointment to get a test. Maybe that's the simplest way to remember it. If you're sick in any way, you shouldn't be leaving your house. The only acceptable reason to be leaving your house is if you already have an appointment for a test. You go, you get tested, you don't leave your car, you go back home, and you stay in isolation in your house. A couple of other announcements. This afternoon, the courts extended their closure for all non-essential business through May 17th. I want to thank the courts for taking this step. More generally, I'd like to thank the courts for their cooperation. My office has been in touch with the chief judges of all the courts. You've all been terrific in helping us at every step in making decisions and helping Rhode Islanders through this crisis. So I want to thank you for your cooperation. Importantly, what this means for the people of Rhode Island is that you cannot be evicted at any time for any reason between now and May 17th, because an eviction is a court procedure and the courts are closed for non-essential services. I will say I hear from people all the time who are struggling to pay the rent, and so I want you to know you won't be evicted because you can't pay the rent. And if anyone tells you otherwise, I want you to call my office, because it isn't true, because the courts are closed and you cannot get evicted. I also know people are struggling to pay their mortgage, and we're working on ways to provide relief around that, and I hope to have an announcement in the next few days or next week to help you get some forgiveness, because I know it's impossible to pay a mortgage if you and your family are out of work. So I want you to know I don't have a good answer to that right now. I hear you. I'm working on it, and very soon I hope to be able to make an announcement around mortgage payments to give everybody some breathing room. We have been getting a lot of questions about food and food delivery. This is an issue for so many people right now. So many kids who are used to getting at least 2 meals a day in school, but schools are closed. Elderly folks, seniors who are used to relying upon senior centers for their 2 or 3 meals a day. And of course, people who are in quarantine and isolation, we need you to stay at home if you're in quarantine, but also we need you to be able to eat, and so we're ramping up our food delivery. I want to remind you that we have a new website. It's called ridelivers.com, ridelivers.com. If you're in your house, if you're homebound, if you've been ordered into quarantine, if you're sick and you can't get out, I want you to go to ridelivers.com, and we have a number of ways to get you the food, groceries, or meals, prepared meals that you need. To give you a sense of it, in the last week, more than 40,000 Rhode Islanders have used that website. We're distributing over 25,000 meals a day through Meals on Wheels, senior centers, schools, and other community partnerships. We've distributed nearly 100,000 non-perishable meals to communities all across Rhode Island through our partnership with the Food Bank. Thank you to the Food Bank for all that you're doing. And I especially want to acknowledge Rock's Fresh Food, a fantastic local grocery. We've partnered with them, and they have delivered meals to over 800 families since we launched this partnership just a few days ago. So my top priority is making sure Rhode Islanders are safe and healthy, and of course well-fed. That's the Italian mother in me. We should all always be well-fed. So we're doing everything we can to make sure everybody has the food that they need to get through this. Every day, we're adding more people, more groceries, getting more donations, and we're going to have a greater ability to deliver more food. But if you're hearing me and you're stuck at home and you need a hand, ridelivers.com. If you can't get to a smartphone or a computer, pick up your phone and call 211. 211. It's a United Way hotline. They'll help you get food delivery. And also you can go on a new service that we've offered, nextdoor.com, nextdoor.com, and it may be that a neighbor or a friend in your community would be willing to bring you food. You can register what your needs are at nextdoor.com. Contact tracing. I'd like to talk for a minute about contact tracing. So when we started 5 weeks ago, we had a very blunt approach. And it's been pretty blunt the whole way, shutting down whole sectors of our economy, asking large groups of people to just stay at home. As our system is evolving, as our knowledge of the disease is evolving, we are trying to move to a place where we get much more pinpointed in our approach. More testing to figure out more quickly and accurately who is positive, and then what we call contact tracing. A lot of people have said to me, you keep talking about contact tracing, what is it? What it is a very detailed process that if you test positive, the Department of Health will get in touch with you and go through a really detailed process of figuring out all the people who you've been in contact with. Because we then need to go tell those people that they've been exposed to you and they are at risk for having coronavirus. So we've been doing this for 5 weeks, mostly manually, and God bless the people at the Department of Health. It's unbelievable what they've done. Amazing, amazing. Mostly manual, many man hours, person hours of work, and they've done a beautiful job. But if I'm going to open this economy, and I am going to as quickly as we can, it has to be more automated and more scalable. So we've been working hard to build a system that is both automated and scalable. And today I'm proud to announce that we in Rhode Island have partnered with a company called Salesforce.com. I'm sure many of you have heard of it, especially in business. Salesforce.com, it's a global software company, and we're partnering with them to make our contact tracing process more efficient, more scalable, more reliable. For you, the average Rhode Islander, you might not see that. You won't notice that. But it should give you great confidence that our systems are getting so much better and we're that much closer to getting you back to work, because this is essential to get everybody back to work. So the same thing will happen. If you get tested positive, you'll be contacted by the Department of Health, and they will go through a system to figure out with whom you've been in contact. Over time, in a week or 2 weeks from now, where I want to drive this is to have the whole system be much more automated. You could imagine a system where you track your symptoms online, maybe on your phone. You set yourself up an appointment on your phone to go get tested. After you're tested, there's this somewhat automated contact tracing system, and then we monitor your quarantine and isolation all through an integrated system. So that's a snapshot of where I want to get. We are not there now. We're working 24/7 to get there, but that's the kind of a system we need to have before we can all start going back to work or thinking about going back to work. You've also heard me every day for the past few days ask you to please keep a contact notebook. Again, I've gotten a lot of questions. Do I really need to do that? What's the point of it? Here's the point of it. I cannot get you back to work unless everybody keeps a contact notebook. It is impossible to keep a mental list of everyone you've been with in a day or a week. So what I need you to do is at the end of every day or throughout the day, write down on a piece of paper everywhere you've been and everybody you've had physical contact with. When you go get yourself tested, if you have symptoms and if you get a test, you should bring that contact tracing notebook with you to the test. You shouldn't try to go and get a test without it, because it means you're not prepared. So I need everybody to get really serious about this, so that then when you get the phone call from the Department of Health and they say, who were you with yesterday, who were you with a week ago, where were you, what surfaces did you touch, we'll be ready and we can move more quickly and keep you safer. So I hope that clears up all the questions I was getting about what are you talking about with contact tracing. I do want to take a minute to address the Jewish community in Rhode Island. Tonight is, of course, the first night of Passover. It's a time when families all across the state and all around the world come together to celebrate a very special, very important, very holy holiday. And of course, this year it'll be different. This year it will be different because you have to obey the social distancing order. Social gatherings cannot be more than 5 people. I know that's really tough. This will be different, and I'm asking you to please obey that. And I know it will be difficult. But it's, it is a time for when you get together for your Passover Seder, it's a time that the Jewish people retell and celebrate the story of triumph and freedom over an enemy. And I think that is more appropriate than ever this Passover, as we all together maintain our sense of hope that we will triumph and have freedom against this common enemy. And so I know that you will not be able to celebrate with your families and friends and communities in close proximity in the way that you want to and the way that you should be able to. But I want you to know we're thinking of you, we're deeply sympathetic, and I personally hope that message of hope and triumph over an enemy rings even truer this year for you and your families than ever before. And I will say Chag Sameach to all of our Jewish brothers and sisters, and a happy Passover to all. I especially want to thank Rabbi Sarah Mack and the Rhode Island Board of Rabbis for working with us and giving direction to your congregations. I have to say I've been incredibly inspired by the stories I've heard for all the plans for virtual Seders for tonight and the ways in which you're adapting your customs and traditions to the coronavirus world. Thank you. Thank you for the leaders in the community for working with us, for helping us to enforce these social distancing rules. And as I said, all the best today, tonight, and in the coming days. Of course, I also want to recognize members of other faiths. This is, of course, Holy Week for Christians, Holy Thursday, Good Friday, Holy Saturday, and of course, Easter. Everything will be different this year. Just like Palm Sunday was different, Easter will be different. Churches, unfortunately, will have to remain closed. And I will ask you to do the same and get creative. Continue to worship, continue to pray, continue to find hope in your faith and in your faith communities, but do it in a safe way. I've heard about churches having services broadcast over the radio and people sit in their cars in the parking lot. That's great, as long as everyone stays in the car and keeps the windows closed. But these are the kinds of creative ways that we have to continue to worship, but to do it safely. And of course, in the Muslim community, Ramadan is coming up in only 2 weeks, and I, of course, have more to say about that, but the same thing applies. Start making your plans now, because mosques will not be open, and we will not have an opportunity to have large gatherings and large prayer services as we all would like to do. 2 other things. I've been getting a lot of questions around the order that came down yesterday from the Mayor of Providence, Mayor Lorza. First, I want to thank the Mayor for his leadership. He has shown decisive and swift leadership throughout this crisis in keeping the people of Providence safe, and has been a good partner to me and to the state throughout all of this. He announced yesterday that parks and boulevards would be completely closed. And he did that for good reason. He wants to keep people safe. We have had the chance since yesterday to speak with the mayor and to have the Department of Health speak with the mayor. And so I want to clarify that a bit because we are getting a lot of questions. The policy in Providence will be implemented in a very similar way to the policy we have at the state around parks and beaches, which is to say, if you are lucky enough to live within walking distance of a park or a boulevard, then by all means, go take a walk. Go walk your dog. But the parking lots will be closed, and we don't want you driving there to go for a walk. And above all, we do not want to see crowds or people congregating on the boulevard, on any boulevard, in any park, in Roger Williams Park, in your local community park. In an effort to assist the mayor with enforcement, we will be offering additional resources and help from the state police and DEM as necessary to make sure that we monitor this. So we're going to try this. We're going to try it and see how it goes. If a week from now we have reports, people are in, huge crowds at Roger Williams Park, Blackstone Boulevard is packed and there are groups of 6 or 7 people together, then we will have no other choice than to totally close down the parks and the boulevards. And I really don't want to do that. Everybody deserves exercise and a little fresh air. It's a little sanity to get out of your house. So help us help you. Enjoy a walk, but please do it safely according to these rules. And thank you, Mayor, for working with us. Finally, I'll end on a happy note, an inspiring note, inspiring to me, and I hope inspiring to you. It's crystal clear to me that when the going gets tough, Rhode Islanders come together. And this is about as tough as it gets. The stories that pour into me every day of people can't afford food, their kids are struggling in distance learning, they can't afford to pay the rent, they're sick, God forbid they've lost a loved one to the virus, people in nursing homes. I hear you, and I want you to know we're working every day to address these needs. On the bright side, a lot of people are stepping up to say, what can I do? How can I help? How can I donate? And today I'd like to take a second to call out Mark Perlman at Ocean State Job Lot. Starting today, Job Lot is making free fabric available to anybody so that we can all make our own fabric face coverings. Every job lot has a display set up, and they have enough free fabric for 1 million masks. Obviously, surgical masks and N95 masks need to be reserved for healthcare and truly essential workers and first responders. But for everybody else, every time you leave your house now, we're asking you to wear a cloth mask. Not everybody can have access to that kind of a mask. And so due to the kindness and generosity of Job Lot, everybody can go to Job Lot for free, get the material, and make a mask. And I also know that today they were in Pawtucket giving away food and meals. And I want to thank you, Mark, and thank you to Ocean State Job Lot, a locally owned and grown Rhode Island company, really stepping up when we need it most. So with that, I will turn it over to Dr. Alexandra Scott.
Thank you, Governor, for those updates. Good afternoon. I also want to thank you all for tuning in. The Governor and I are sharing messages every day, but we also need you to help us by being the messengers as well. There's nothing like getting information from someone you know and love. If there is someone in your life who isn't able to watch these daily briefings or who maybe isn't as plugged in to social media or the news, please help us by passing along these important messages that you're hearing every day. As the Governor said, we have 220 new cases today. This brings our total to 1,450. As the governor also shared, we sadly have 5 additional fatalities to report. We now have 35 COVID-19 associated fatalities total. Of the 5 people whose passings we are reporting today, 3 were in their 70s, 1 person was in their 80s, and 1 person was in their 90s. The person in their 90s was a Golden Crest nursing home resident. The person in their 80s lived at Oak Hill, as did one of the persons in their 70s. While I'm on the topic of data, I want to pull back and return to something I got asked about yesterday, which is demographics and race and ethnicity. There has been coverage over the last few days nationally about racial and ethnic disparities that are being noted in cities and states across the country. That highlights why we have, for many times before this pandemic, spoken often about zip code and how much zip codes matter. While we can't say anything definitive yet about Rhode Island, we understand when these types of disparities occur. We are still building out our data system right now here for Rhode Island so we can look at things in a more granular way. And oftentimes it's because of the enormous amount of data that we are collecting in a very short window of time. However, we do know definitively that there are certain environmental, social, and economic factors that make certain people more vulnerable. We talk often about making it so that your health should not depend on the zip code that you are from, and knowing that zip codes can lead to differences in outcomes. When we have stressed situations such as this pandemic, those types of disparities are more evident. For example, if people don't have access to fresh fruits and vegetables in their community on a regular basis, that contributes to underlying health issues like diabetes and other medical conditions. And we know that while quarantining and isolation are key guidances that we are giving and that they are challenging for everyone, we know that it can be even more challenging for people who live in communities with less access to good, stable job opportunities that pay a living wage. We also know it's more challenging for people with unstable housing conditions. There's also the challenge of exposing many of the other structural inequities that occur. There can be differences in policies or discriminatory approaches across the country in place based on race and ethnicity, and we know many communities deal with that. These are just some of the examples that highlight why you're seeing certain communities now with higher rates of cases and, unfortunately, of deaths as well associated with COVID-19. As we respond now and in the future, when we start to rebuild and repair, we need to be very conscious of these kinds of structural inequities, ones that we have been talking about for quite some time, and ones that the numbers that have been asked about clearly make evident. Separately, I want to address the issue of isolation, because we've received a few questions about that adds to what the governor already spoke to. If you go into isolation because you are feeling sick, which means if you are not feeling well, you need to stay home, you should stay home and in isolation for at least 7 days. On top of that, you need to be fever-free for 72 hours, 3 days, during a time which you're not taking any fever-reducing medication, and all of your symptoms need to have resolved completely. before anyone can be considered cleared of the illness they have, whether COVID-19 or any other viral infection. As a reminder, isolation means staying home if you are ill with symptoms and doing everything you can to stay away from other people in your home as well. That might mean using a different bathroom or being in the kitchen in shifts. Lastly, yesterday, I highlighted the need for healthcare workers who have symptoms to also stay home, because that is critical given the population that they are caring for. I want to add two things to that, because people are continuing to hear that message and respond so that the folks that they're caring for remain safe. We are working to prioritize opportunities for healthcare workers to be tested, so that if they're staying home when they're ill, it can be known whether or not these are symptoms of COVID-19 or otherwise. Additionally, because people need to stay home if they are ill, we want to continue to make out that call for volunteers, particularly in our nursing home settings and other healthcare facilities. When the healthcare workers are doing the important work of staying home if they are ill, there is still a need for the healthcare workers to provide the care for the residents in nursing homes, assisted living, and other healthcare facilities. So Rhode Island Responds still needs volunteers, and we're also working on making ways for people to begin to get an accelerated license for becoming a certified nurse assistant or feeding assistant. So please go to riresponds.org if you want to get involved to volunteer and be able to assist, knowing that healthcare workers are doing what they need to best care for the people that they are treating. We are looking to strike the balance between having symptomatic healthcare workers stay home, but also make sure that we have the staff levels needed in Rhode Island healthcare facilities across the state. So with that, I'm going to give it back to the governor so that we can get started with questions.
Good afternoon.
Good afternoon.
We begin this briefing with a question by Steve Alquist of Uprise RI. He must be the fastest typer of all reporters because he always seems to get the first question. He asks, Governor, grocery store workers across the country are starting to test positive for and die of COVID-19. Do these workers and all low-wage essential workers deserve time and a half hazard pay and mandatory workplace safety by executive order if need be?
Yeah, so thank you for the question. And I'd like to take a minute to acknowledge the fact that while so many people are out of work and laid off and struggling, there are many thousands of Rhode Islanders who have to go to work every day, most especially healthcare workers, first responders, many people in state employment in cities and towns, and grocery store workers. And I want to thank you for doing your part in this crisis and for your bravery. It is the responsibility of every employer to do everything they can in order to protect the health and safety of their employees. First and foremost, it means any employee who is sick, even a little bit, has to be sent home. Cannot be forced to work, period, at all, under any condition. And I want to remind everyone that by federal law, you have 10 days, a minimum of 10 days paid sick leave. So that's extremely important. We are certainly working hard on our end to procure more surgical masks and gloves that we're going to continue to push out to healthcare workers, and PPE, the respiratory masks and gowns. We're pushing that out to folks in healthcare. And I would say the same for grocery stores. You need to do everything that you can, space out your employees far enough, give them hand sanitizer, ample opportunity to wash their hands, nobody comes in when they're sick, and do everything that you can do to keep them safe.
Next question is for Dr. Alexander Scott. This is from Matt Allen. Can you describe how someone is officially determined to have died from COVID-19? Is there an assumption that if they die while infected with the virus, that is the virus that killed them? If so, does that artificially inflate the fatality rate data?
Thank you. We are specifically using the term COVID-19 associated fatality. We understand that if someone has COVID-19, it may or may not be the cause of their death, but it's important for us to be able to have the data that shows that COVID-19 was associated with that person's death. This is consistent with the public health approach across the country on how we are assessing the fatalities associated with COVID-19.
Our next question is from John DePietro, and also a question for you. It was announced that when the state hits 80% capacity at hospitals, the makeshift ones would be utilized. What percentage are we at now, and when do you envision we hit the 80% mark?
That's an important question. We are using a variety of mechanisms to be able to see when we need to expand to the alternate care sites that are working very quickly to be set up in place. So I don't have the numbers specifically of the percentage of where we are now. We can certainly get back to providing that. But we are working closely with the hospitals to be able to surge their capacity first within the hospital settings prior to expanding to an alternate care site. So working with them, we have a targeted approach in terms of when it is necessary to expand to those additional sites, while the hospitals continue to do the work that they have to plan for increased capacity within their localized facility. We have both mechanisms being advanced forward together simultaneously.
This next question is actually for both of you and the governor, from Tony Mendez of Poder 102. How do you disconnect from these difficult times we're living? What do you recommend Rhode Islanders do to find peace and remain sane in this new reality?
That's an excellent question, Tony. It is so important to be able to take a breath and to reflect during these times. For me personally, it's looking at what things around me I have to be thankful for. You know, if we're not able to get together with family the way we'd like to, I'm thankful that my family is safe and I can still communicate with them electronically and on video. Or if we're not able to, be able to go to a social gathering that we'd like to go to, we're thankful to be able to come together and have a meal or what's needed to move forward. So those are ways for me to be able to take a breath and reflect on what things I'm thankful for in the midst of that, and use that to stay motivated to keep going forward every day.
Thank you. Governor?
Thank you. I agree with everything Nicole said, as I always do. You know, I love to go outside. I continue to say this, but I think even just a walk around the block and a chance to, the flowers were starting to be in bloom. There's a lot of beauty, and so just getting outside, taking a walk, taking a minute to slow down. I think exercising every day is very important. And a phrase that General Callahan has taught me is a battle buddy. Try to get a battle buddy. So try to find a person or persons, people in your life who will check in on you and you check in on them. Of course, you can't see them, and that makes it difficult, but I said so many times, don't let yourself get isolated. Even if you're alone physically, pick up the phone and call somebody, text somebody, FaceTime. Just find a way to prevent yourself from being isolated and have human contact. Every single day, make sure you have some human contact. And it'd be great if you could have human contact with the same people and you have an arrangement where you help each other out. Because so many people out there are saying, oh God, this is so hard, how are you doing? I'm struggling like everybody else, ups and downs every single day. So know that you're not alone, and find a way to keep yourself connected with some other people in your life.
Steve Klampkin from WPRO asks, can you foresee any assistance for college students living on their own but who've lost their jobs and cannot pay for food or rent?
Yes, so excellent question, and I'm going to continue to find specific answers. At the moment, unemployment insurance, chances are you're eligible for it. I want to remind everybody, as of yesterday, the new unemployment insurance rules are in effect. So freelancers, gig economy, et cetera, workers, go to the DLT website, file for unemployment insurance. All of the food delivery that we are mentioning, or the food bank, or 211, we are raising a lot of philanthropy to help folks get through with food, with essentials, with rent, and that's for everybody, including college students. So I don't have an answer specifically for college students specifically, but we will continue to work on that, and I'm open to ideas. But remember that everything that's available for everyone should be taken advantage of by college students.
Next question for the doctor from Tanya Signori of the RI Echo. For people who are former smokers that catch COVID-19, how does this impact their recovery?
We are seeing that folks who are former smokers are oftentimes also associated with being people who may have some forms of underlying illness, oftentimes associated with being a former smoker, and are having a little bit more of a challenging time with COVID-19. It does tend to impact the lower respiratory system where our lungs are, and so it is something that people can be aware of. It's helpful also for people who are currently smoking to know that there is benefit in quitting smoking, and you can still go to 1-800-QUIT-NOW to receive the services for doing that. And then it's also helpful to know for people who are smokers or otherwise, there are other vaccines that are out there that can also help minimize, like the flu vaccine, the pneumonia vaccine, are also good to get to help build your reserve in being able to combat this and prevent against COVID-19.
This next question from Alan Gabberty, it's broken down into a bunch of different questions, so I'll start with what criteria must be met to diagnose recovery, for example, 2 negative tests, and is someone who's recovered without testing able to carry and spread the virus?
So there are 2 strategies to be able to clear someone of COVID-19 or say that they have fully recovered. There is a test-based strategy, which is 2 negative tests over more than a 24-hour period. We're usually reserving that approach for folks who may be hospitalized with COVID-19, and the hospital needs to know whether or not personal protective equipment is still needed if a person has recovered from their symptoms but is still in the hospital. The second strategy is a non-test-based strategy. It's one that's just based on symptoms. This is what we are recommending for the majority of people who have COVID-19, hospitalized or otherwise. It means that you have to have at least 7 days since the symptoms began. You have to have the last 3 days be one that you have no fever, and that's without taking any fever-reducing medication. And the last 3 days have to involve improvement of symptoms, and your symptoms need to have completely resolved. With all of those applied, that is when someone is considered recovered from COVID-19, and it's particularly important for people who need to return to work.
He goes on to ask, how many in Rhode Island have recovered, and is that number reflected in daily updates?
So the way we are able to determine that is knowing the number of new cases that we have, plus being able to see who is hospitalized and then who has unfortunately passed away. The remaining numbers between those 2 groups of numbers are all people who have recovered.
The next question, Governor, is from Michael Bilo of Motif Magazine. A hunger strike has been reported at the Wyatt Detention Center, and a drive-by in-car protest has been announced for Friday at 11 a.m. You've worked with the Rhode Island Department of Corrections at the ACI, but what authority and responsibility do you have for Wyatt? What are your options?
So I was not aware of that, and I don't have authority over Wyatt because it's a federal facility. Having said that, I do care deeply about what's happening in my state, so I'll have to look into it more. Do you have anything to add?
Next question is from Ryan Belmore of What's Up Newport. Wedding season has arrived in Rhode Island with hundreds of weddings scheduled across the state over the next 3 months. What advice or guidance do you have for those couples who are planning to host their big day?
Yeah, so this is a tough one, and I've heard from a number of couples. This is obviously very personal. We cannot relax the restrictions now, so which is to say you cannot have a large gathering under any circumstances. So if you wanted to have a small, intimate wedding with 5 or fewer people, go ahead and do that and get married, and then I would say push off the bigger celebration for later. But at least for now, and I think it's safe to say in the months to come, it's going to be very difficult for us to allow large group gatherings. So for your own planning purposes, I'll leave it to you. But I think if you want to go ahead and get married, keep it small now and plan for the party much later in the year or next year.
Next question from Bill Bartholomew. Are surgical masks being distributed for grocery store and pharmacy employees?
Grocery store and pharmacy employees fall within the group that I've referred to previously as our critical infrastructure workers. These are workers that we strongly encourage wearing some form of face cloth mask, face cloth covering, so that they are able to minimize the amount of infectious particles that are released into the air. We have a team of people working night and day to get us the supply of surgical masks that we need in this state for the long term and for as many people as need be. When those are available, we will look towards being able to advance those to critical infrastructure workers who we think would benefit. But it's important for everyone to know the ability to wear the face cloth coverings is an effective way to go forward as you are doing the critical infrastructure work that you're doing.
Our last question for this Wednesday briefing is for the Governor. From Ted Nisi of WPRI, the British Prime Minister is in the ICU with coronavirus right now. Hopefully you do not get sick, of course, but what is the contingency plan you have in place if you yourself fall ill?
Well, of course, it would depend how ill I were to become. If I'm able to work from home, then that's what I'll do. If I have to go to the hospital, we have a terrific team in place, and I think I'll leave it at that. I think we all know what happens with the chain of command if something more were to happen to me. But I want people to know this. Although you see me every day, there's 1,000 people behind me, more than 1,000 people behind me, working 7 days a week. I have set up a series of work streams. I have a team on PPE. I have a team on thinking about how to get the economy reopened. I have nearly 1,000 National Guard men and women deployed all over the state, getting our surge plans in place. We're working well with the hospitals. So I don't plan on going anywhere, and I know how to work from home. But I want you to know we've got this. It isn't just me. It's an army of people, and every day we get a little bit better at what we're doing.
Thank you, Governor.
Thanks.
Thanks, Doctor. Stay well.